Hi, I'm Dr. Nadia Elihu. I practice internal medicine here at St. Joe's with pulmonary consultants and primary care physicians of Orange County. And I'd like to take you grocery shopping. I find that healthy eating starts with healthy shopping. So, let's go to the store. If you have garbage in your cupboard and refrigerator, well then, that's what you're going to eat. So, throw it all away and let's start over. Before you go to the store, I want you to think about what you're going to eat for breakfast, lunch, dinner, and snacks for every day of that week. When you get to the store, start in the fruit and vegetable section. This is where you should do most of your shopping. Stock up on lots of fruits and green leafy vegetables. Don't forget the celery and carrots for the next time you need a snack. Also, don't be afraid to try some new things like green beans or sugar snap peas, red bell peppers, yellow bell peppers. There isn't any label shopping to do here. Just look for all the different colors. Now, sometimes patients will say to me, "But Dr. Elihu, I don't like vegetables." Well, learn to like them. There has to be a recipe out there that works for you. But don't saturate the vegetables in oil and cream. That defeats the whole purpose of eating them in the first place. Next, head to the poultry and meat section. There is no label reading here, but you can still make better choices. Opt for the ground turkey instead of the ground beef. It's less fatty. And get some skinless chicken breast. And don't forget the fish, that's a very important part. The dairy section has some label reading. Plain low-fat and non-fat yogurt and cottage cheese is the way to go. Check the label. Look for sugar and high fructose corn syrup. Your yogurt doesn't need that stuff. You can chop up some of the fruit you bought and throw it in there fresh. The bread and pasta section requires some reading. Look for whole grain and whole wheat. Choose the whole grain over the multigrain. It's higher in fiber. Also here, check for the sugar and high fructose corn syrup. We still don't want any of that. In the cereal aisle, the labels can be more complicated. But I find that at a glance, I can look for the fiber content and see which cereal has more fiber. And of course, look for the sugar content and see which cereal has more sugar. You may want to know what I'm going to do with the cereal that has more sugar in it since I already bought it. Well, I consider it dessert. And every once in a while, I'll let my kids have it for a treat. They're active, running around, they're growing. They can eat it occasionally. You and I, we're not growing upward anymore. We're only growing in one direction. So we don't need that. As you can see, we skipped the soda aisle. Now, you have a cart full of healthy things to eat. And next time you go grab something in your cupboard and refrigerator, you don't have to think twice. You're good to go.